Hello, everybody. This is Dr. Bob DeMaria with another episode of Ask Dr. Bob from Naples, Florida and Westlake, Ohio. Why don't you join me? Here we go. Dr. Bob, I have an iodine allergy and most of my conditions are likely due to an iodine deficiency. So imagine that, sensitivity to iodine. What do you do? Well, we actually have a product that we use that's based in a parotid tissue called cytozyme parotid. And we have used it to help people work through the iodine deficiency or sensitivity. But oftentimes you could be toxic in bromine, fluorine, and chlorine, and that's why iodine might bother you, because the iodine is pushing those toxic materials out of your body. Dr. Bob, can you reply on the ALT or talk about the ALT and the AST test, which are liver tests? And does it tell you if a liver is overloaded? Now, the word is physiologic and pathologic. We have seen enlarged livers on films, but the tests are normal. On the other hand, you could have no body signals and your liver enzymes, which I just mentioned, ALT and AST, can be elevated. So you really need to have a history. We use films, we do the test. If your ALT and your AST are increased, you have the potential to have toxic liver overload. There are other markers, but that definitely are the two most important or are very important. Dr. Bob, which is better, B complex or B12 for women? There are a lot of different kinds of B vitamins. We usually encourage our patients, our practice members, to have blood chemistries done. If your uric acid, for example, is low, we might supply or supplement with B12. If your carbon dioxide is low, we might use thiamine or B1. If your liver enzymes are low, we may in fact use B6. So there's a variety of factors that we use to determine what a person needs, because everybody is different. Dr. Bob, I've been reading your book about women and menopause, and I have thyroid symptoms. And you get cold and you get fatigued, and you wanted to know what foods you could take and that you have some sensitivities. What I would encourage you to do is first have a thyroid panel done, maybe a urine iodine loading test to see if you have enough iodine. But the reality of it is we can do a test called the FIT test for food sensitivity. It'll tell us about 130 foods that you might have issues with. And what we do is we find out what foods you might have a sensitivity to. Let's say eggs. Well, we would encourage you to stay away from all poultry for about 3 months, letting your body get a chance to reset. Very good question. Dr. Bob, I've been dealing with dry mouth and low saliva, and you've taken some over-the-counter medications for some time, and you have this dry mouth that still won't go away. Well, there's something called the sympathetic nervous system. And if you have a lot of stress in your life, the sympathetic nervous system will speed your body up, and your mouth and your body will be dry, including dry eyes. The parasympathetic nervous system, on the other hand, moistens the body up. So we would need to determine where your body's at. We use a variety of blood chemistries. The Opti-Chem, we look at your calcium and phosphorus ratio. That would tell me if you need some phosphorus. So there are testing that we can do, but I know that your body tends to be sympathetic dominant. Your body is speeding up. Last question, Dr. Bob, I have a 13-year-old granddaughter and a 11-year-old granddaughter, and you're having some issues because you want them to have some blood chemistry done and they don't want to have it done because of the needle. Well, if you were to contact us, there is a lab that we can send you a kit for, that we could actually, in the comfort of your own home, use a little lancet, get some blood from that, put it on a little cardboard, send it off to the lab, they'll send us the results, and we could have some conversation. Tremendous questions. I know they'll make a difference. I'm Dr. Bob DeMaria.